First, this is not the ideal time for Santé Québec to come in. We could not plan that 2 years ago, but I think, look at it the opposite way. I think it's an opportunity. I'm so pleased that they have been preparing for that during the summer, putting the team together with a good CFO, a chief financial officer that comes with a lot of experience in making turnaround. Madame Dugas is well reputed. We have people that are very expert in technology. What I'm saying,
$1.5 billion deficit.
We manage over 60 billion per year. That's what we manage. To be able to do the correct thing, say around $1 billion, with good measure on 60, that's not mission impossible. But you need to have the right people with the right information. We cannot continue to manage 3 or 4 months behind. I've explained in French earlier, that couldn't make sense, that we could not have the monthly result so late. We need to be following that, and that's exactly what we're doing.
So what message do you have for patients?
Expectation.
When Quebecers have a lot of expectations that Santé Québec is going to solve a lot of the problems in the healthcare system. What's your message today? Is it going to help? Is it going to reduce wait times, reduce surgery times? The opposition was saying you never hit your 90-minute wait time in the emergency wards. What's going to improve with this?
Well, I don't have that much time to talk about the opposition, but I think you have time. First, as I said many times, Santé Québec is not the only thing that will make a difference. That's one of the tools. I think there are some tools, as I said, we have made many of those efforts, and I'm talking on the TSO, I'm talking about the private agencies, you can name them. What we have been doing with certain professionals that will help the doctors, that will be able to take more appointments because now they are helped. So I talk about all those measures. So Santé Québec is one of those measures. But I said clearly to the Quebecers, and that's the reason I'm putting a lot of pressure on the union of doctors. I'm not talking to the doctors themselves. I'm talking about their union, that sometimes they're playing the calendar, they're playing the clock. And I want to make sure the Quebecers understand that. We have been asking changes to many people in the system. The nurses, you remember, we have been firm asking for mobility, flexibility. I'm asking those things to the doctor as well, to say, well, those changes that we asked, they need to make those changes as well.
You're only controlling 5% of the spending.
Exactly.
So your trouble is you have a lack of leeway, isn't it?
Well, that's the reason. That's the reason I'm asking. I gave the example earlier, and I'll finish with that. I'll give the example earlier that if I want to be able to pay a doctor that will go at home as opposed to being in his clinic, I think that would be normal that we pay him better, and we need to adjust the result within the envelope. I'll go for the last question.
What are you saying to patients who are still concerned that they're going to see their services cut? There are many that when they hear budgetary rigor, even if you say their services won't change, don't believe that.
As I said, we're managing 60 billion a year. I think we are able, when we do the right thing with the right people that can manage this sort of amount, 1 billion per week. We have many weeks left to make sure that we have a rigorous way of managing those budgets.